Hey everybody, I'm Dr. Katie from HealthWorks Spine and Sport, and this is my lovely model, Terrence. And in the previous video, we had talked about some potential causes and contributors to knee pain. And today, we're gonna show some techniques about how we treat knee pain or knee dysfunction. So what we're gonna do today is demonstrate some active release technique, or ART. It's one of the certifications that I have to work on muscular and ligamentous dysfunction. And I'm gonna demonstrate what it looks like on the quad, and specifically the lateral quad. So they're called the quads because there's 4 of them. So depending on which one is dysfunctional is going to determine what quad or part of the quad we're gonna work on. But we're just gonna assume for this demonstration that it's the lateral quad. So the beauty of active release technique is it's very muscle specific. So depending on what muscle is dysfunctional, there's going to be a different action that usually the patient is going to do while I'm basically compressing, adding tension to the muscle to elongate and help break up scar tissue, loosen up muscle fibers, that kind of thing. So for the lateral quad, Terrence is lying on his back. I'm gonna get my contact onto that lateral quad. He's gonna keep his knee straight, so we're shortening the muscle. I'm gonna back up my contact, and all he's gonna do is he's gonna start to bend that knee, nice and slow, controlled, as far as he can, but I'm gonna help him a little bit so the hamstring doesn't start to spasm, and bring it back a little bit more. So Terrence doesn't have great range of the quads, so that's about as far as we're gonna go, and then he's gonna straighten back out again. Now, the quadriceps muscle group is very important when it comes to knee pain because all these muscles come down and converge on the patella. And then from the patella, it essentially turns into the patellar tendon down here and inserts right here on the tibia. So when you have a lot of dysfunction up here, it can indeed manifest as knee pain along the joint or pain along the patellar tendon. So people will come and saying, hey, I have patellar tendonitis, and they expect us just to treat here, but we really have to look up a little bit further. And not only just in the quadriceps, but look at all these adjacent muscle groups to really treat the dysfunction properly so it just doesn't come on back. So that is a demonstration of active release technique. We shorten the muscle, then we lengthen the muscle as the patient goes through a range of motion.